Vaccine development started with Edward Jenner in 1796 with the accidental discovery of the smallpox vaccine. He had made a correlation between milkmaids with cowpox and their immunity to smallpox. He had the idea to take pus from a milkmaid's hand and inject it into an 8-year-old boy named James Phipps. Jenner concluded that with the injection of the cowpox virus, it provided the child with an immunity to smallpox. Jenner's experimentations led him to the idea that taking a virus and inoculating someone with it will provide immunity. In a continuously modernizing society, vaccinations have improved and evolved. As vaccinations became a more regular part of society, they lost the positive publicity they once had. As the 20th century rolled around, the thought of vaccination was not only viewed as necessary, but something that was required. After the founding of the World Health Organization, vaccine implementation was spread globally. As vaccines lose positive promotion, there are groups that start to question the necessity, validity, and safety of vaccines. The anti-vaccination movement came to a head when influential people such as Professor Gordon Stewart began publishing articles that allegedly contained evidence supporting the claim that thimerosal was linked to neurological development issues. Many celebrities and social media outlets have enhanced public fears by providing inaccurate and false information. Vaccines have become a source of doubt and inaccuracy because of the spread of social media and information that is from unreliable sources. The Centers for Disease Control released an immunization schedule for 2017 of the immunizations that children should receive. Vaccines that children should receive include hepatitis B, rotavirus strains 1 and 5, diphtheria, tetanus, acellular pertussis, Haemophilus influenzae type B, pneumococcal conjugate, inactivated poliovirus, influenza, measles, mumps, rubella, and varicella. Infants will receive the first dose of the hepatitis B vaccination within 24 hours of being born, and then receive the second at age 1 to 2 months, and the final dose at age 6 to 18 months. The rotavirus vaccine is administered at ages 2 months and 4 months, while another strain, RV5, is given at 2 to 6 months. The vaccine for measles, mumps, and rubella comes in 2 doses. The first dose should be administered at 12 to 15 months, and the second at 4 to 6 years. All of these vaccines are not only recommended by the CDC, but are required to attend most public schools in the United States. If parents do not vaccinate their child within the given time provided by the CDC, they are considered non-acceptors. The CDC divides parents into 3 different groups to classify their level of vaccine acceptance. Parents of children ages 1 to 18 can be classified as non-acceptors, hesitant acceptors, and acceptors. These guidelines are to ensure herd immunity continues to work. When people are administered vaccinations, they receive what is known as active immunity. Active immunity occurs when a person is exposed to a disease and their body begins producing antibodies to fight the disease. Vaccinations are composed of a weakened form of the disease that allows the body to recognize and then produce antibodies. Vaccinations are a safe form of introducing diseases to the public with the outcome of providing immunity. The danger of a parent not vaccinating is not only risking their own child, but the children around them. Thimerosal is considered to be one of the main culprits of creating negative vaccine bias. The preservative was created to prevent potentially life-threatening contamination with harmful microbes. Thimerosal is a mercury-containing compound that preserves certain vaccinations, such as the measles, mumps, and rubella vaccine. In certain cases, the preservative has been linked to the weakening of the immune system and causing gastrointestinal issues, but there are no proven scientific facts that directly link thimerosal as the single causation of neurological development issues. According to Marley Graybiel, 8 children in Europe were found to have gastrointestinal symptoms and lymph node nodular hyperplasia after receiving the MMR vaccine in 1998. After careful observation, researchers concluded that there is no data supporting an association between the MMR vaccine and autism. Celebrities and social media influencers can impact the reception of vaccines. Celebrities such as Jenny McCarthy, an American actress and model, has publicly announced her negative attitude towards vaccines, assisting in creating the fear pertaining to vaccines brought forth by media outlets. Many physicians, educators, and other people in the medical field have to come to the realization that there is no proven data that supports the idea that thimerosal is directly linked to the cause of autism. The implementation of the National Childhood Vaccine Injury Act was put into place by President Ronald Reagan in 1986. This bill was part of a much larger plan to ensure that healthcare was safe and effective. This movement began because of parents' growing concerns about the link between vaccination and neurological complications. The Injury Act was to ensure vaccines were created within federal guidelines, ensuring the safety of vaccines, and control the distribution of vaccines in an attempt to prevent monopolization. The Act also holds distributors, such as Gardasil, accountable for any vaccine-related injuries. These precautions have tried to reassure the public that vaccinations are safe and effective. In a society where most people receive their news and information from social media, there is no guarantee that the information absorbed is true. According to a study from Pew Research, 2/3 of Facebook users read their news on the platform, with 59% of Twitter users getting their news on Twitter and 70% of Reddit users doing the same with their respective platform. Facebook reaches 67% of the adult American population, while Twitter only reaches 16%. This puts Facebook on top, with 44% of the population getting news from the network. This shows that a large percentage of adults receive news and information through social media. Social media platforms such as Twitter, Facebook, and Reddit do not always have the ability to check if the information being provided is true, so this means many Americans are misinformed or educated. There needs to be action taken to combat the misinformation of the general public. The human papillomavirus is the most common sexually transmitted infection. The virus is spread through sexual interaction or contact. The HPV virus is very contagious. 79 million people are infected with HPV. Strains of the human papillomavirus are most commonly identified as genital warts and cancers. The vaccine was created to protect against strains HPV 26 and HPV 18 that cause cervical cancer, and strains HPV 8 and HPV 11 that cause genital warts. Gardasil, a HPV vaccine, was recently developed to combat this rapidly spreading infection. Merck & Company manufactured Gardasil, and the vaccine was approved for expanded use to prevent certain vulvar and cervical cancers in 2008. The vaccine is considered optional in 47 states and required in Rhode Island, Virginia, and the District of Columbia to attend a public school. The HPV vaccine often receives negative backlash from parents and healthcare providers because it brings forth a sensitive subject, such as sexually active teens. The Advisory Committee on Immunization Practices provides a suggested list of what vaccines children should receive in order to live healthy lives. To receive data back about how many adolescents are receiving vaccinations, there is NIS Teen. NIS Teen is an annual survey that collects data on vaccines received by children 13 to 17 years in all 50 states. In 2016, 60% of teens received the first dose of the HPV vaccine. This may seem like there is no lack of vaccination, but when analyzing the data for receiving the next 2 doses, the numbers greatly decline. The data provided by the CDC concludes that parents may be vaccinating their children with the first dose of the HPV vaccine, but do not tend to follow through with the other 2 that are necessary to ensure immunity. Many parents are apprehensive to introduce the HPV vaccine to preteens because they are concerned about advocating sex. The vaccine ideally targets boys and girls ages 11 and 12 because most healthcare providers want to prevent the cancer-causing infection before sexual activity begins. Most adolescents receive the first vaccine but do not continue receiving the other 2 doses. Many factors contributing to the lack of the last 2 doses include more children who live in metropolitan central cities are more likely to receive the vaccine. Children aged 17 to 18 were more likely to be vaccinated as opposed to children 13 and 14, and children who live below the federal poverty line were more likely to be vaccinated than children living at or above. All 3 doses of the vaccine are being administered at a rate that is below standard. Although children are receiving the first dose of the HPV vaccine, There needs to be improvement in implementing and promoting the last 2 vaccine sessions to ensure immunity. The issue is that people are misinformed about vaccinations. Because today's society is driven by technology, medical advertisers need to edit the way the information is reaching their audience. Instead of having posters and information just on one website, fact-based information needs to be released to social media outlets, enabling them to reach broader audiences. There should be commercials provided by the CDC, presented on national television. Radio broadcasts would also reach an older audience, enabling more children to be vaccinated. Doctors need to be unbiased when talking about and administering vaccines. There needs to be a reinvention of how healthcare systems advertise vaccinations, especially newer vaccines. The public needs to be reassured that new vaccines are just as safe as older vaccines. Parents and children need to be educated on the safety and efficiency of vaccinations. Public schools should take action in educating children earlier so that when they reach adulthood, they would have the information necessary to make an educated decision. As society continues to modernize and evolve, marketing tactics have to mirror that evolution. The CDC and other vaccination information outlets must take into consideration their new up-and-coming audience. As media becomes a prevalent outlet in society, information must be presented in new and varying ways to reach the targeted audience. Vaccination is an important part of staying healthy. We cannot just ignore that people are being misinformed about the importance of vaccines. As a nation, we need to be strategic in the way we are informing, educating, and advertising immunizations. So in my survey, I chose children ages 15 to 17 to participate in taking it. I wanted to obtain data that represented the knowledge levels of adolescents at Shadle Park. I also created an online survey to reach an older audience. I wanted to gain data that represented adults' knowledge levels. After receiving the data back from both of my surveys, I compiled and calculated the data of the 10 shared questions from each of the surveys for the varying age categories. Because I created an online survey, there was a limitation that I could only create 10 questions. So in my paper copy, I created 20. I had to cut it down, so both of the shared questions are a baseline, so it's both questions that both adolescents and adults answered. So in question 1, 74% of respondents answered true, 26% answered false. Question 1 asked respondents, I feel vaccines are necessary to keep people healthy. This data shows that the majority of people agree that vaccines keep people healthy. When answering question 2, 38% of respondents said true, while 62% said false. The question provided to the respondents was, I feel as though I understand what HPV is. This data concludes that the majority of respondents do not understand what HPV is. Question 6 asked contributors, I feel the HPV vaccine is unsafe. The data showed that 42% said true, 58% said false. This concludes that even though the numbers are close, the majority of people felt as though the HPV vaccine is unsafe. The participants' answers for question 7 came to be 76% of people answered true, 24% answered false. Question number 7 asked, I would feel comfortable vaccinating my child based on my knowledge. The data shows that the majority of people would feel comfortable vaccinating their children. Question 9 asked participants, I feel the HPV vaccine is only necessary for girls. The majority of people, 94%, thought that the HPV vaccine was only for girls, while only 6% thought it was false. Question 14 asked, I believe a person cannot get HPV through sexual contact. The majority, 52%, thought that this statement was true, while 48% of people thought the statement was false. This shows that the predominance of people thought that HPV was not sexually transmitted. Question 16 asked participants, I feel that access to vaccines is limited because of income. The data shows that 51% of respondents say false, 49% say true. The next question 18 asks, I would feel uncomfortable receiving the HPV vaccine. The majority of respondents, 54%, agree that they would feel uncomfortable receiving the vaccine. The lesser amount of responses, 46%, say the statement is false. Question 19 asks, I believe that receiving 1 dose out of the 3 of the HPV vaccine will provide me with immunity. Most responses, 73%, say that the statement is false, while 20% say the statement is true. This shows that people understand that receiving 1 dose will not provide someone with immunity. Question 20 asks, I believe that my physician thoroughly discusses vaccines with me. There was no majority or minority. The data shows that 50% say the statement was true, 50% say the statement was false. This survey was created to answer the question, do people have enough information to make an educated decision about vaccines? When calculating the data, I learned a lot about what people did and did not know. During the calculation of the data, I rounded the numbers as it was easier to represent it. During my research process, I made a discovery that people do not have a major distrust of older vaccines, but distrust newer vaccines that have not had the trials and tribulations of the past. In this era of fake news, people are unsure what is true and what is false. Websites are able to post and create any information they want with no scientific backing. News headlines are used to scare readers and assist in continuing to create negative bias surrounding the HPV vaccine. There needs to be an end to misinformation and the panic it creates. Healthcare providers need to talk to their patients, promote vaccines, and educate others around them. Vaccine information needs to be easily accessible and marketed toward audiences of varying ages. In a fake news world, we need to end negative stigma surrounding vaccines and reinvent how they are advertised, provided, and discussed.
Emily, hang on, you have 3 follow-up questions. Emily, how did you evaluate the sources you collected to make sure they would be credible, valid, and reliable? And which sources did you discard and why?
So most of the sources I found were on ProQuest, like a data website. I used like those filters that show like academic research papers, and what I noticed was like kind of how you knew what they were talking about was if it was a professor that was noted in multiple different articles. I discarded any information that like I couldn't find multiple articles, or kind of if I knew that they didn't know what they were talking about, like they didn't have any background within the medical field.
Emily, how might your conclusions, your findings, relate to the current body of work that is in the community today?
My findings represent that currently the adolescent and adult population is uneducated. It shows that there is a need for education and discussion within varying age groups.
Okay, finally, Emily, if you had 3 more months to work on this research project, what additional research strategies would you put into practice?
I think it would be physically meeting one-on-one with experts, such as like maybe contacting a CDC representative, contacting a medical marketing representative or